could just throw some light on the area of presentation that you've chosen for the summit.
All right. So, well, first of all, I would like to say that I highly appreciate the endeavor from your organization to bring up with such a summit, and I'm thoroughly convinced that this is a great platform where all of us coming from different parts of the world, we are sharing our various advances of medicine. As far as my presentations are concerned, I've got two back-to-back actually. My first presentation is disease-specific. It's on thyroid cancer, and my second presentation is on an administrative level. The first presentation on thyroid cancer is, I think the challenge of thyroid cancer is, it's a very curable cancer, but it is very multidisciplinary. I mean, it starts from the primary care, picking up thyroid nodule, and then it traverses the entire gamut. It goes from pathology to radiology to surgery to nuclear medicine to molecular biology. So there have been a lot of recent advances that has been made, and it is my belief that once we revisit those newer advances and share with each other, we can hopefully implement to our patient care. My second presentation is, as I said, on an administrative level. It's titled Digitization of Medicine. This is about the absolute necessity for us physicians to adopt the technology that we have. And to that end, there has been a very novel approach that has been created by this company called Crimson. And this approach has been adopted by as many as 30 to 40% of the American hospitals here. And it has given a tremendous improvement.
Sure,
Digitization of medicine is that we are utilizing the electronic medical records, so that through our accessibility through electronic medical records, we can actually find out how we physicians are performing. And if we are not performing to our optimum level, we have an opportunity to learn. So when I get into the database of the various physicians, then I know that, let's say for a particular disease, how a particular physician is performing, and we compare it with the national cohort that we have, and we see how other physicians have been performing, both in terms of whether we are utilizing the right resources that we have. Number two, whether we are using the appropriate length of stay. Sometimes, patients, they come, they get admitted, and they stay forever. Now, that probably doesn't have to be done. We have a very strong IT department. The IT department, actually there is a beautiful marriage. It's a marriage between the administration of the hospital, us who are the physicians, and the IT department. So what we have done is we have adopted this company's software. The name of the company is Crimson, where this software is picked up by our IT department, so they know how to run this software. And through this exceptionally new software, we are actually getting into the medical records of all the physicians. And we are seeing exactly how the patient was treated. The rest of the United States have done this at an appropriate time. So the physicians take it. I mean, they take it in face value, they take it in a good way, and then they try to improve. So we get into all the teeny-meeny details of a physician's approach towards patient care, and we compare it. I mean, we are not judging anybody, but we are kind of comparing, almost like a healthy criticism, saying that if you could have started with this medication at this period of time, then the patient would have benefited more. So this is a great learning experience where we all sit together and we discuss the different ways that we can improve. So it's a great conglomeration of the IT department, the administration of the hospital, the physicians, we have social workers, case managers, all of us, we get together and we see how we can improve our patient care for particular diseases.
Sir, you've seen both the sides of it, the industry in the US and in India. So how would you relate to whatever findings and the studies that you have done, how would you relate to with Indian healthcare scenario?
Well, this is the relevance of it, because India has come up so much in technology. We have made such, I'm using a dramatic terminology, bludgeoning advances in science technology. I think the time is right when we apply this technology into various fields. I mean, that is applicable for any fields of profession. I mean, we apply technology to physics, to chemistry, but more so in medicine because it's a very encompassing industry. And I see the relevance. I think the time is right where we should now that we have the technology per se, now the challenge is to implement it in the various fields of medicine. So, I mean, when I came to this country, and I'm looking at almost 20 years back, and we have had a lot of training, and and we brought it to this country. But the technology in the last 10 years has been tremendous in India, and I see the potential and I see the promise.